Hi everyone, welcome to our population health presentation recording. As we're completing our MSP project in May, we have chosen to focus our presentation on a national health issue that is affecting Vietnam, HIV/AIDS. Since the first case of HIV was diagnosed in Vietnam in 1990, prevalence rates have continued to increase, with the Ministry of Health stating that AIDS is currently one of the top 3 causes of death. As of 2015, there were approximately 260,000 individuals who had been diagnosed with HIV living in Vietnam. However, the number of individuals living with the condition is thought to be much higher due to people remaining undiagnosed. Factors that could prevent people coming forward to be diagnosed include fear of stigma, discrimination, limited education, and limited health service access. Furthermore, a disparity exists between villages, with estimates of some mountainous and remote minority villages having HIV prevalence rates up to 10 times higher than the national average. The most at-risk populations for HIV in Vietnam include people who inject drugs, men who have sex with men, and female sex workers. However, the proportion of women who have contracted HIV has been steadily increasing. In 2000, the United Nations held the Millennium Summit, which at the time was the largest gathering of world leaders to date. During this summit, a list of 8 Millennium Development Goals were developed for each UN country to work towards achieving by the year 2015. The sixth goal was to combat HIV/AIDS, malaria and other diseases, with the aim for HIV being that by 2015 the prevalence was to be halted and the spread having begun to be reduced. The Vietnamese government signed onto this convention, and since the year 2000 the Ministry of Health has implemented a number of initiatives throughout the country to address this public health concern.
The project we've chosen to focus on today is titled Integrating Nutrition into Health Services in Vietnam, and was conducted between the years 2008 to 2014 by an American organisation known as FANTA, or Food and Nutrition Technical Assistance. FANTA are a non-profit organisation whose aim is to improve the health and well-being of vulnerable individuals living in developing countries. They do so by strengthening food security and assisting in the development of nutrition policies, programs and systems. The project was funded by the United States Agency for International Development, or USAID, and FANTA worked in collaboration with the Vietnamese government and the United States President's Emergency Plan for AIDS, or PEPFAR, to implement the project. The project had 2 main aims. Firstly, to introduce nutritional assessment, counselling and support to health services for persons with HIV living within 10 provinces of Vietnam. Additionally, the project sought to improve the management of malnutrition in children under 5 years living in the Dak Lak province, which is located in the Central Highlands.
Implementing this project, the FANTA Group utilised a multifaceted approach. The first aspect that FANTA worked on was integrating nutrition into health services for people living with HIV. This involved organising a national subcommittee, the development of national guidelines for nutrition care and support of people living with HIV, a workshop to introduce and support the implementation of the new guidelines, the development of training materials, and the provision of training to improve the skills and competence of community-based care providers in managing and counselling malnourished patients. Secondly, FANTA completed 3 assessments to inform nutrition and HIV programming, the first being a qualitative study of infant and young child feeding practices among HIV-positive women. In 2010, FANTA conducted a second study investigating the prevalence of malnutrition among HIV-positive adults. The study found 27% of adults were malnourished, and generally food consumption was not meeting the National Institute of Nutrition recommended dietary allowances for adults. An association was found between poor nutrition and higher clinical stage symptoms and infections. The study's finding prompted a list of recommendations to combat and manage malnutrition within this vulnerable population. The third study undertaken was a comparative study looking at 2 different ready-to-use therapeutic foods for the treatment of malnutrition and the acceptability among HIV-positive children and adults of these 2 bars. The 2 investigated were Plumpy-Nut, a peanut-based imported bar, and Hebe, a high-energy bar for integrated management of malnutrition, which was a newly developed local alternative. Results of the study showed that of the 2, Hebe was the preferred choice of majority of adults and children. Following the study, the product was approved for use in Vietnam, and it was advocated that Hebe be included in the list of medicines that are covered by health insurance and integrated into programs for the treatment of malnutrition. Lastly, there was a pilot of integrated management of acute malnutrition in the Dak Lak province. Initially, FANTA worked to assess the capacity of hospitals in integrating nutrition services. Little nutrition assessment and care was found due to a lack of anthropometric equipment nutrition suppliers and training. From the findings, Fanta worked with stakeholders to determine the amount of equipment and nutrition supplies required and developed a plan to receive these supplies. Working with the district and community health professionals, Fanta planned to introduce nutrition for children 5 years and under into the healthcare services. They offered training, support and supervision for doctors, nurses and village health workers.
Due to the many elements of this project, we've chosen to focus on only one aspect of the project, that being the assessment that Fanta completed of infant feeding practices among HIV-positive mothers and the resulting recommendations. Findings of this assessment indicated that there were many challenges and barriers to achieving optimal feeding practices. These findings then informed the development of the national guidelines and informed the training provided for local healthcare service providers. The assessment found that all mothers practiced mixed feeding, which is breast milk and replacement feeding, and most had introduced complementary food prior to infants reaching 6 months of age, and no households had met the conditions for safe replacement feeding. The report concluded that the government need to take action to either discontinue the provision of free infant formula with the aim of supporting exclusive breastfeeding, or alternatively to promote safe replacement feeding. According to the World Health Organization's updated guidelines on HIV and infant feeding from 2016, it's recommended that mothers that are affected by HIV should continue breastfeeding and are supported and advised to do so. However, should also be receiving lifelong antiretroviral treatment to prevent postnatal transmission through breastfeeding. This is seen as the best strategy in optimising HIV-free survival for uninfected but exposed infants and children. A systematic review from 2014 investigated antiretroviral treatment interventions in preventing the transmission of HIV through breastfeeding. This review stated that ultimately there is a potential risk of HIV-infected mothers transmitting this disease through breastfeeding. However, it is further stated that HIV-positive mothers living in developing countries should not practice replacement feeding with their infants. This includes other foods, liquids and infant formulas, as there are significant associated morbidities such as diarrhoea due to the likely risk of preparation without adequately clean water. In Vietnam, as affordable, sustainable and safe alternatives to breastfeeding are generally unavailable, it's apparent that exclusive breastfeeding in conjunction with antiretroviral treatment to either the mother or child is the safest option. Therefore, by enabling the safest nutritional practices for mothers and their developing infants, Fanta are providing the most up-to-date, evidence-based strategies to ensure the best health of both mother and child. Ultimately, this aims to prevent a number of health complications that may arise through unsafe feeding practices.
From an occupational perspective, adequate nutrition assists in achieving optimal health and is therefore essential in enabling occupations. HIV has many ill effects for those that contract the condition and can contribute to reduced food intake, which can both cause and aggravate malnutrition. The immune system becomes significantly weakened and individuals can have an increased susceptibility to infections and a compromised ability for treatments to be effective. Fanta's initiative to provide assessment and counselling to improve the nutritional status of those affected enables engagement in occupations. Without nutritional intervention, the health of those with HIV may be so severely affected they may become marginalised. When considering the occupation of breastfeeding, there are many benefits for both the infant and the mother. Breastfeeding plays an important role in ensuring that a secure attachment is formed between mother and child. This attachment assists in the development of the infant's brain on a biological and chemical level. In addition, the breast milk has nutritional properties that further enhance the infant's brain development. Oxytocin is a hormone that is released in the mother when she breastfeeds, and the effect this has on the mother continues to increase the level of attachment with the newborn. This also has a number of associated benefits such as improving confidence in maternal caregiving skills, significantly enhancing mental health and improving parenting skills. Ultimately, it is a very protective factor for both the mother and child's physical and mental health by preventing a very wide range of health concerns.
The Ottawa Charter was developed in 1986 to assist in achieving the objectives of the World Health Organization and is made up of 5 action areas. The Fanta project is closely aligned with 3 of these areas. The first action area that was addressed within the project was that of creating a supportive environment. Enabling supportive environments allows people to have protection from factors that can lead to ill health. Fanta utilised this approach through the assessment they conducted into the therapeutic foods for malnutrition. They utilised research and completed consultation with key stakeholders prior to making a recommendation regarding the better supplement, which was then added onto the list to be covered by health insurance. By making the supplement more widely available and accessible, a supportive environment was created whereby mothers whose children were becoming malnourished could easily access and afford the therapeutic foods. Secondly, they reorientated health services with aims to refocus the health services to encompass the needs of individuals and the broader community. This can involve greater lengths of health research and changes to the education and training of health professionals. This action area was addressed throughout the project. Firstly, upon the development of new guidelines surrounding nutrition care, a workshop was held to educate and support national and provincial health managers in the implementation of the guidelines. Furthermore, a training resource was developed to expand health professionals' knowledge on the relationship between nutrition and HIV, develop skills in assessment and counselling for HIV-positive persons, and to manage acute malnutrition in HIV. These education points result in a change of direction and quality of the health services provided. As a means of supporting the needs of individuals and the community, 2,500 children underwent screening for malnutrition and were provided with treatment accordingly. The final action area incorporated within this project was to develop personal skills. Developing personal skills allows an individual to exercise more control over their own health and their environments. This was addressed through the facilitation of parent education. 131 parents were provided with counselling and education on ways to manage and improve their child's nutritional status. This included distributing information on ways to improve their child's diet, water, sanitation and hygiene. Developing caregivers' knowledge and skills in these areas enables them to make more informed decisions regarding the care that they are providing for their children.
The FANTA project can be viewed from the International Classification of Functioning Disability in Health, or ICF framework. This framework depicts in a hierarchical structure how a health condition or disease is directly related to an individual's ability to participate in activities. Also influencing this participation are the bodily structures, functions, and the impairments that people may experience due to their condition. In addition, participation or restriction of is directly linked to activities. Environmental and personal factors are also depicted as playing an important role in contributing to people's ability to engage in activities. When related back to the FANTA project, the health condition of HIV has a very large impact on bodily structures and functions, as mentioned previously. These impairments can severely limit people's abilities to engage and participate in activities. Personal factors such as self-stigma and other factors can also contribute to people's occupational disengagement. The FANTA project's work begins at and targets the environmental level, where they aim to adopt nutritional assessment, counselling and support on a large scale through the implementation of policies and improvement of healthcare provision. Over a period of 6 years, FANTA has adopted a large-scale approach to strengthen the management of malnutrition for children. The effect this environmental approach has on the health of individuals is profound. With improved health status through the improved services, individuals will not be as limited, both physically and emotionally, to participate in activities. This could then further contribute to improved personal factors too. As has been previously mentioned, there were a number of relevant stakeholders within this project, including USAID, the Vietnamese government, the US President's Emergency Plan for AIDS, Vietnam's National Institute of Nutrition, and the health service providers within the 10 provinces. The sustainability of this project is maintained for a number of reasons. Firstly, many of these stakeholders were local and the healthcare service providers were each located directly within the provinces. Secondly, much of this project aimed to educate and provide training. This training included workshops, manuals and other resources that can continue to provide for healthcare workers in the coming years. Though there are some really important factors that have been implemented to ensure this project's sustainability, it's important to note that the funding utilised was only for the pilot project. Future funding would allow the program to extend beyond the 10 provinces and promote nationwide implementation.
Implementing strategies of workforce development, the establishment of multi-sectoral partnerships and funding are all critical to the FANTA project. Workforce development was necessary in this project in a number of ways. Firstly, the capacity of government healthcare providers at HIV care and treatment sites was strengthened to provide nutritional assessment, counselling and support. The development of Vietnam's first legal nutrition document, titled Vietnam's National Guidelines for Nutrition Care and Support of People Living with HIV, the development of training materials to build the capacity of healthcare providers in antiretroviral clinics, and the training of doctors nurses and village health workers on the guidelines for integrated management of acute malnutrition and nutrition in HIV in Vietnam. In regards to the establishment of multi-sectoral partnerships, FANTA worked alongside the National Institute for Nutrition, provincial AIDS committees, outpatient clinics providing HIV services, and other organisations supporting HIV to implement the guidelines. They also worked with UNICEF to calculate quantities of specialised food products, equipment and other supplies required for the pilot. They also worked with local authorities and the Department of Health, District and Commune People's Committees, the Women's Union, the Farmers Association and other healthcare providers to advocate on the important role of nutrition for children under 5 and for those with HIV. In terms of resources, the FANTA project was quite large and achieved a number of great things. Many human and non-human resources were utilised to make this project happen, and given what it has achieved, it is fair to comment that there were adequate resources. However, this pilot project worked within only 10 provinces in Vietnam, and there are 63 in total. The issue of HIV malnutrition still exists countrywide, therefore there are currently inadequate resources available to address this issue within Vietnam.
At the conclusion of the project in 2014, FANTA had made a number of achievements, including 2,557 children under the age of 5 have been screened for malnutrition, 131 caregivers of moderately malnourished children have been counselled on how to improve their child's nutrition situation, 92 children were treated for severe acute malnutrition, 37 healthcare providers were trained in nutrition and HIV, 31 village healthcare providers were trained in nutrition screening, referral, counselling and follow-up of malnourished children. Longer-term outcomes, a developed action plan was made for USA to support more years of nutritional initiatives for those living with HIV, in coordination amongst the PEPFAR partners. At the completion of the project, FANTA made a number of recommendations to assist in maintaining the program and replicating beyond DACLAC. Foremost, they suggested that awareness should be raised amongst mothers regarding how to prevent malnutrition and encourage them to seek health service assistance prior to their child becoming severely malnourished. The second recommendation was that the capacity of health staff should be enhanced in relation to their management of acute malnutrition, with the encouragement of routine assessment, clarification and consultation. And that the packaging and form of the Hebe therapeutic food should be changed and made to be more child-friendly. So thanks everyone for listening to our discussion of the FANTA project, and we're sorry that we can't be there here with you today to join in on the discussion. However, we do have a couple of questions for you. So firstly, other than breastfeeding, are there any other occupationally based strategies that you could identify? And secondly, if there was to be a continuation of funding for this project, do you think that anything should be done differently? And are there any particular strategies you would prioritise if the funding was limited? Thank you.